Hello and welcome to this episode of CQC Connect, the podcast from the Care Quality Commission. CQC has an ambition to be a world-class regulator, driving improvements in how people experience health and care services and working towards a safer future. To help achieve this vision, we're developing a new strategy to start from 2021 that builds on the work we've previously done and takes us forward. My name is Sam Wallace, Provider Engagement Lead here at CQC, and today I'm joined by two guests to discuss one of the new themes of the strategy, meeting people's needs. To start off, I'm going to ask my guests to introduce themselves. Jill, can I start with you?
Hi Sam, yes, my name's Jill Morell and I'm Head of Public Engagement at CQC.
Thank you, Jill. Ronald, can you introduce yourself?
Hello, I'm Ronald Morton. I'm a Policy Manager in the Adult Social Care team.
Great, thanks both and thanks for joining us today. Jill, can we start with you to tell us a bit more about this theme and what it covers?
Yeah, delighted to, Sam. So this theme, meeting people's needs, is really about how CQC wants to champion the needs of individuals and communities. What we want to do is regulate through their eyes and focus on the things that matter to them when they use care, when they access care, and when they move between services in particular, because that's when a lot of people experience problems when they're moving between care services and they find that they're not joined up enough. So it's about regulating through the eyes of people, making sure that we understand and report and act on what matters to them and to local communities. And we want to really work with others in the system to improve outcomes for people by looking at how well services and the local care network is meeting their needs. And we want to have a particular focus on those who are most likely to receive poor care. So that's people living in poverty, those who experience inequalities, those whose circumstances make them vulnerable. So I think one of the things that we have learned during the current crisis due to COVID-19 is that there is a tremendous will in the country to work together to improve health and social care. People have really shown what they can do as citizens during this crisis. And I think it's also exposed the inequalities that are prevalent in society at the moment and that we need to address them quickly. I think what we want to do in our new strategy is both build on that intent to improve care in our country through active citizenship, but also to work together to address some of the problems that we have seen very starkly in recent months.
Thanks, Jill. Ronald, is there anything else you'd like to add to that?
Yes, I think it's really important to state that we have a very unique role in looking across the health and social care system, and we want to explore sort of variations in the quality of care, either by locality and by people's outcomes and experiences. People's feedback to us give us the intelligence we need to use to regulate social care and healthcare services. And we need to be transparent about what people tell us and, as Jill said, how we acted on it and what the outcomes were.
That's great. Thanks both. I'd be really interested to hear a bit more about why you think this is a really important area for CQC to be looking at. How is this going to help us become a better regulator?
For CQC to be a better regulator, it needs to have people's interests and what matters to them at its heart. Otherwise, the work that we do, the information we publish, the action that we take will not improve care for people unless we understand what matters to them, unless we are really much better at hearing from people about their experiences. So we need to transform that area of our work to make sure that we really understand what's happening to people, what matters to them, and that we act on it, because that will enable services to improve the care that they provide to people. And we know so much now about the inequalities that people are experiencing when they access services, when they get diagnosed, when they get treated, and in their outcomes. There is a lot of inequality. We also know their health impacted by local prevention, poverty, housing, and other societal factors. So we feel like we really want to make a difference in this area by working with providers, working with system partners to improve both people's care and the local environment that they're receiving that care in.
Thanks, Jill. Ronald, is there anything you'd like to add to that?
Yes, just to add a little bit to that, we have the ambition of helping empower people to improve their own care by making sure they have a clear understanding of the standards that they can expect from care service providers. In addition, we want to involve people in co-producing and co-designing everything we do with people who use services, and we have the ambition to become a world leader in doing this, and that's a really important way of bringing people into the organisation, understanding what matters to them and how we can act and respond to that properly.
Just to add to that, what we want to also see is providers and commissioners and local system partners working with their local communities and working with local people to co-produce services and to co-produce care pathways. And as Ronald says, it's something that CQC is committed to doing, and we know other organisations are also committed to that, but we want to see much more commitment generally to that across the board.
So it sounds like this theme is very much about involving and including people who use services, their relatives, and other people in the community at every stage of our work. So when we're developing what we do, but also when we're delivering our functions. Is that right?
We're committed, absolutely right, Sam. We're committed to co-producing, co-designing our work with people, and our Experts by Experience programme enables people to work with us in our regulatory work, in the delivery of that regulatory work. So we are committed to doing that, but at the local level, what we want to see is providers and systems also committed to co-designing services and pathways in partnership with them to make sure that the services that are delivered meet their needs. That requires an understanding of the local population and a commitment to diversity as well, and to addressing inequalities. And we really want to work with all our partners to come together to address these inequalities.
So I think it's fair to say we already do quite a bit of this work at the moment, but obviously in our new strategy, we'll want to be taking it even further. Jill, could you say a few things about the kind of areas we might need to develop or change in our work as we go forward?
I think really it's about transforming how we regulate, not just areas of change. I think that in order to understand what people are experiencing, we need to transform how we collect and understand that intelligence and those experiences. In order to look at what matters to people, we need to change the way we assess services, care services, and maybe building on the I statements that were developed some years ago now. We're looking at how we can incorporate them already, but I think we want to do much more work in that area so that we're looking at the things that people really care about, as I say, when they access, use and experience care services and when they move between them. Also being transparent about what we're hearing from people, and also transforming how we provide information to people. We want to provide information that meets people's needs when they need it and in the way they need it, when they're either choosing care or wanting to understand what the local care services look like and care pathways. So I think it's about transforming everything that we do.
That's really helpful. Thanks, Jill. Ronald, is there anything you'd like to add to that?
I think one of the particular issues that we're looking at is to build upon what we've already done to make our independent voice heard, and that would help drive change and improvement. That would help through sharing good practice and celebrating success, and it's really important to make a good loud noise about successes within the care sector. And that's also helped build our reputation as a trusted and valuable source of information, and that's what we want to do for people who access and use care services.
And that leads me quite nicely on to my next question. So if we think about a few years down the line and we've successfully delivered this theme in our strategy, what would success look like for us? What's the ideal outcome we're trying to achieve?
So I think the ideal outcome that we're trying to achieve is that people are supported to understand the quality of care in their area, understand what they can expect to receive, what standards they can expect to receive, expect that those standards will be based on what matters to them, and have information that enables them to choose care for themselves or their loved ones. I think they can expect as well to see what we've done with intelligence that they've shared with us and how we've acted on it. I think they can expect to see us regulating through their eyes, from their point of view. I think as a regulator, we have a unique perspective in that we have oversight of all health and social care services, and we have the power to improve care for people by supporting providers to do that and supporting people to enable them also to improve care services. And it's really vital that we play that role to the full for the better of everyone using care.
And just to add, Jill, I think that would help create a better and healthier nation going forward.
Absolutely.
That definitely sounds like a really good outcome. So at the start of this podcast, I mentioned that we're still in the process of developing our strategy and developing this theme. So to finish off, it'd be really interesting to hear from both of you some of the key questions we're still trying to answer and some of the key areas we'd really like to get feedback from people so we can take this strategy work forward. Ronald, can I start with you?
I think one of the key issues for us is to dig down into what exactly people want in a local area and community so that we can identify that, act on that and respond to that, and that will help the improvement of care services for all people, not just people with the loudest voice. Jill mentioned earlier on people who have perhaps been excluded, people in poverty and people whose circumstances may make them vulnerable. So we want to be fully inclusive and make sure that no people are left out of this.
Thanks, Ronald. And Jill, any key questions for you that you'd like to see answered at the moment?
Yeah, just to build on what Ronald just said, I think some of the key questions are: what information would work for you about the quality of care in your local services, in your local area? What would good information look like? What would good look like when we ask you to share your experience of care with us, that intelligence that is so vital to our work? What would good look like to you? What would good look like if you were to feel empowered to understand the standards of care you should be able to expect and to encourage the services that you use to improve? What would that look like? Those are some of the key questions, I think. And also, what do we need to do as a regulator to improve inequalities, to work with others, to work with providers, to work with system partners, to work with you to improve inequalities and health outcomes for people?
And thanks both for joining us on this podcast episode, and thanks everyone for listening. If you'd like to find out more information about our strategy and how to feedback, there's information in the description for this episode and on our digital engagement platform, Citizen Lab. Look out for more episodes on our strategy and other topics coming soon, and I hope to speak to you again